Today we're going to be talking about perineal tearing, what it is and how we can prevent it, because let's be honest, who does not want to try to prevent perineal tearing? Now, a lot of you may be thinking, okay, I know there could be tearing down there, but what even is perineal tearing? We're going to go over the anatomy of it so that you can be educated and understand your body a little bit more and hopefully prevent perineal tearing, or at least the severity of perineal tearing. Now, this is one of the most common questions I get as a pelvic floor PT, and that's exactly why I wanted to do this video, because every woman deserves to understand what's going on with their body and how to best advocate for themselves. Now, before we do that, I want to introduce myself. I am Doc Lizzie. I'm a pelvic floor physical therapist specializing in women's health and fitness, and I have a huge passion for educating women on their bodies and how you can heal optimally, but also prevent a lot of these things that we hear about during pregnancy and postpartum. So I'd love to hear from you in the comments where you're at in pregnancy, or maybe if you just have questions. I love connecting with each of you. So let's go ahead and dive into this topic for today. I know perineal tearing is a worry for many, especially leading up to birth. And if this is your first time birth, just not knowing what's going to happen. But when we can understand the anatomy of our body, it can help ease a lot of those anxieties and worries because you know what your body is capable of. Your vagina knows how to give birth. It was made for this. And amazingly, it can stretch 200 to 300% of its resting state to accommodate for baby coming out of the canal. And that is absolutely incredible. Now, if we think of the tissue of our perineum as Play-Doh, Play-Doh is pliable, right? Now, if we have this Play-Doh and we're working with it and we allow it to stretch slowly over time, this will help that tissue to not have tearing. So when we talk about the techniques within this video of controlling pushing or allowing that tissue to stretch, this is what it's made to do. It's made to stretch slowly over time. Now, if we are doing things like not allowing that tissue to stretch, or maybe we are pushing too forcefully or trying to force baby out too quickly, this is what can happen. As we push, and it tears so much quicker because we don't allow time for that tissue to stretch. Now, there are things we can do prior to birth, such as perineal massaging. We're gonna get into that later in this video, so stay tuned so you know what the most up-to-date evidence is on perineal massaging prior to birth. But things like that can help to prime the tissue. And also, like I said, controlling the pushing to allow for that tissue to stretch slowly rather than the quick stretch. Now let's dive into what the anatomy even is so you can get a better visual. So that tissue pliability we just talked about is this area right here, your perineum, from your vaginal opening to your anal opening. Now when we have a perineal tear, there are 4 different degrees of perineal tears. Number 1 is going to be just a slight graze of that vaginal opening towards the backside in most cases. Now there are different kinds of tears such as labial tears, or maybe ones that go forward up towards the clitoris, or even internal ones. Now those are really ones that we try to prevent, and a lot of times your provider is going to try to prevent, but they can occur. So just know that those are other types of vaginal tears, but we're not going to get into those for this video. We're going to focus on the perineal tears. So that first degree is just that vaginal opening there. Typically we don't need stitches for this kind of perineal tear, and the healing time is pretty quick within the first couple of weeks. Now if we have a second degree tear, this is going to go into that muscular layer. This is so common for especially first-time vaginal birth mothers. Now, the second degree tear is going to require some stitching, and again, this healing time is pretty quick too. When we get into the third and fourth degree perineal tears, this is what we call severe perineal tears. Now, these are ones that go towards that anal opening, with the fourth degree tear going past the anal opening and into the muscular layers of that anal sphincter, and then also the mucosa layer. So we really want to try to prevent these severe perineal tears, and this video is going to walk you through exactly how we can do that. Now understand that perineal tearing is pretty common during birth, and sometimes we can do all the things to prep for it, or we maybe do all the right things during birth and we still have a tear. There's so much at play with genetics, different things that go on with our birth. Maybe you had to use forceps or something like that. All of these come into play, but hopefully with educating ourselves over our body and just all the things that come with birth and the interventions and whatnot, that can really help us to prevent some of those more extensive and severe tears. So if you do have a perineal tear, that is okay. There's so much we can do to recover from it, so don't feel like it's going to be the end of the world if you do have a perineal tear. but there's a lot we can do to prevent it. So that's exactly what we're gonna do if we can. In this next part of the video, we're gonna dive into a piece of the Mind Body Core program, and this is discussing the evidence behind different techniques for preventing perineal tears and specifically severe perineal tears. So if you enjoy this video at the end, I would love for you to give it a thumbs up and give it a subscribe too, because I'm gonna be going over a ton of different topics related to pregnancy, birth, postpartum, and of course, just overall pelvic floor health and wellness and fitness. So let's dive into the topic at hand today.
Protecting the perineum during labor and birth is really important, and there are things that we can do during pregnancy and birth to help reduce our risk of severe perineal tears. So let's start with what we can do during pregnancy to reduce our risk. Perineal massaging is the most widely used tool during pregnancy to help reduce our risk of severe perineal tears. And there are some studies that suggest starting this at 34 to 36 weeks can be beneficial in protecting us from those severe tears. Now, this is mostly seen in first-time moms rather than those who have had children before. And the evidence is somewhat low, but there has been shown to be benefit in doing this perineal massage. So when it comes to my suggestion on doing perineal massage, I do think it could be beneficial, but I don't think it's the end-all be-all. So if you feel comfortable with it and want to pursue that at 34 to 36 weeks of pregnancy, absolutely go for it, as there's no harm in doing it, and there really is only some upside to it. One thing I do think is really beneficial with doing any sort of perineal work is just the desensitization to that area. So somewhat priming the tissue. When we work on stretching that tissue, it may not necessarily reduce our full risk of having a perineal tear, but it can help with that sensation that we might feel with the stretching and the pulling of birth. Now, it's going to stretch more than we're going to do when we are doing our perineal massaging, but by working that sensation and by working that tissue, it can help reduce that discomfort that we might feel during labor and birth. From what the evidence shows, the way that we push and the way that we use our breath and the different positions that we utilize during pushing have more benefit in reducing our risk of severe tears. So with perineal massaging, there are other things that we can do to help prime our tissue. Now, there's a whole video on how to do perineal massaging that you can go over when you feel ready to start that, or if you feel ready to start that. But the other things we can do are, one being intercourse. Intercourse does a similar thing to what perineal stretching is going to do, and it's going to work that tissue in different ways. So that's always an option. Number two is hydration. So our tissues and our skin need hydration, and especially leading up to labor, we want to be well hydrated. So that's not just the few days before giving birth. We really want to be focusing on this all pregnancy, but especially those weeks and months leading up to labor to help keep our skin and our tissue hydrated. How we eat also affects our body, so we want to be taking in nutrient-dense foods that are going to help with tissue elasticity and overall how we feel. Of course, all the mobility we do with labor prep exercises, relaxing the pelvic floor, working through mobility is extremely helpful when it comes to labor and birth, and then practicing those pushing positions as well. So feeling comfortable in them and then working on our breath in them will help us better in the moment. When it comes to giving birth, there are several things that we can consider to help prevent our risk of severe perineal tears. Now, the number one thing is your provider. That is going to be the biggest risk factor to having a perineal tear or to having an episiotomy. So you want to make sure that your provider has a very low episiotomy rate, and ideally it should be less than 1%. Utilizing our breath and having a slow, controlled breath during the pushing part can be extremely helpful in preventing severe perineal tears. Now, remember when we talked about purple pushing, how that can tense up our muscles and tense up our pelvic floor. When we utilize our breath and allow that to relax, that can significantly help with perineal trauma. Preventing rapid expulsion of baby is another way that we can reduce our risk of severe tears. Now, rapid expulsion is when baby is crowning and they just come right out. So we give that one last big extra push and we don't allow baby to come in and out of that canal and massage the perineum. Now, when we do allow for that slower expulsion and for baby to go in and out of the canal, that is going to help massage the perineum a little bit more and allow for that stretching to happen slowly rather than a quick expulsion, which makes that tissue stretch rapidly, and that can lead to more tears. Now, there's something called the fetal ejection reflex, FER, and this is when we have no control at all of baby coming out, and they can come out really, really fast. That is something that is definitely out of our control, and we don't want to necessarily stop that. So if that does happen to you, or if you have heard of that, that is completely normal as well. But if we can, slowing down when baby is crowning or when we do feel that ring of fire can be extremely helpful. And one way to do that is by using a panting breath. So if you are feeling that ring of fire, or maybe baby is crowning and we are trying to just let it massage that perineum a few times, you can use more of a panting breath. So that can help to slow down your pushing and to slow down baby from exiting. Warm compresses are another option that we can utilize during birth, and this is placed on your perineum by your provider during pushing. There is some evidence that shows that this can decrease our risk of 3rd and 4th degree tears. However, the evidence is somewhat lacking, so it's really up to you on what feels good, or maybe what you and your provider talk about. On the other hand, there is evidence for a hands-off approach, meaning your provider really just lets your body do what it needs to do without any sort of perineal massaging that they do, warm compress, nothing like that. There is evidence showing that that alone can allow your body to do what it needs to do and reduce your risk of tears. Utilizing a mirror is another option, and this is something that most hospitals will have, but you can always bring your own. So talk with your birth team ahead of time if they offer that. But this allows us to see baby coming out of the canal and to help with that rapid expulsion. So be able to control the pushing a little bit more and control baby coming in and out just a little bit better. Now, not everyone will feel comfortable with this or want to do this, so this is totally up to you, but just a way for you to control that pushing just a little bit more. I mentioned briefly the provider doing perineal massaging when it comes to the hands-on versus hands-off approach. And perineal massaging is when the provider will use their hand to massage the perineum as baby is coming out or crowning to hopefully reduce the risk of the tear or to help get that tissue to stretch better. However, this is no longer recommended, so this is something to really talk with your provider about to see what they typically do, or make sure that you make your wishes known that you do or do not want this to occur. Remember that you need full informed consent when somebody is touching you or doing something like this. So if they are going to be doing perineal massaging or feel like it is a good option for you during the birth and during the pushing, you should have full informed consent that they are about to do that and be able to say yes or no to it. I've mentioned before that pushing positions do play a big role in severe perineal tears and overall perineal tears. So it's really important to practice those and get a good toolbox ready so you have those to pull from. There is great evidence out there about different positions that are really helpful, so make sure to review those below. And lastly, there is good evidence showing that water can help with reducing your risk of severe perineal tears. So if you are having a water birth or a home birth, this is a good opportunity for that hands-off approach and for that water to help with some of that tear prevention.
Okay, I hope you guys enjoyed this video and found it helpful. Let me know in the comments if you have any questions or if you did enjoy this video. And again, give it a thumbs up, and I will see you for the next one.